Aloha, good morning, everyone. Welcome to the COVID-19 care conversation on this beautiful Thursday morning. Thank you so much for being here to talk about the latest news and updates when it comes to the coronavirus outbreak here in the islands and around the world. Good morning, I'm Yanji Denise.
And I'm Ryan Kalei-Suji, and each and every day during the week, we have been really trying to connect you, the viewers of the Honolulu Star-Advertiser, not only with us, but with one another to bring up some of the topics and some of the concerns that you have surrounding this COVID-19 pandemic. We are seeing the numbers continue to increase. We are seeing what it is affecting and how it's affecting our entire country. And this is an engagement and an opportunity for you to talk with us and to talk with our guests to learn more about simple topics and things that you can do to help you and your loved ones. We want to thank once, of course, our sponsors for making this broadcast possible.
Yeah, and that is the Hawaii Executive Collaborative. That is a group of business and civic leaders in Hawaii working to make this a better place. We, of course, invite you to talk to us and talk to each other. Give us a good morning, give us a like, let us know that you're here. We have Shayne Enright joining us in just a few minutes. She is the Public Information Officer for both EMS and Ocean Safety on Oahu. And so she's going to be telling us about some of the challenges that the paramedics are facing and what we can all do to make their jobs easier during this difficult time. She's also going to be talking to us about ocean safety's role in all of this. So if you have a specific question for Shayne, please put it in the comments right there. But first, we always start in the morning with the count.
Yeah, and again, that count continuing to rise, as officials say, that number will continue to rise with the overall state total now up 34 cases, up to 258 positive cases in the islands. Now, yesterday's count was the largest single-day increase since the outbreak began, and we are again seeing more and more of these counts go up, especially here on the island of Oahu. We do know that also Molokai and Lanai is still without a confirmed case of COVID-19.
Yeah, and we are starting to see more community spread. When you look at that number, that single day daily increase, the largest so far, that is a pretty tough statistic to see. And that's why it's so important that we do stay inside. Nationally, we saw a pretty troubling headline, COVID-19, now the third leading cause of death in the United States after heart attacks and cancer. So that is pretty staggering to see just how many people are dying because of this. Of course, when we need help, the people we call at the other end of 911 are the paramedics here in Hawaii. Honolulu EMS is doing an amazing job, and we want to welcome Shayne Enright to the program this morning. Good morning, Shayne.
Good morning, Yanji and Ryan. Thank you for having us.
So we're so happy to see you, and you know everyone is staying home now, but we know that you're still getting a lot of calls. Tell us a little bit about how your call volume has changed and the kinds of calls you're getting right now.
Well, first off, I do want to thank the people of Oahu. By them staying home, they are saving lives in more ways than one. Our call volume is relatively stable. It's comparable to last year, which may come as a surprise, and I definitely think our crews aren't feeling that out there. But that's for a few reasons. By people staying home, we're not seeing those normal emergencies like we used to. We aren't seeing as many car accidents. We're not seeing people falling. We're not seeing dehydration cases. So all those types of calls are down. But what we are seeing that's making up for those calls are the suspected COVID-19 calls, where people who are understandably anxious, worried that they might have it, are calling. They're calling 911.
What is the protocol that you do suspect that you have COVID-19? Should you call 911?
Well, first of all, don't wait until it's too late and the only option is to call 911. There are a number of resources right now available. There's the city's hotline. There's the Queens Medical Center hotline. There's 211 if you're experiencing flu-like symptoms. Of course, if you're experiencing difficulty breathing, we want you to call 911. We want to be there. We will be there to take care of you. But why we need to say this is what people need to understand is we have a limited amount of resources. EMS for the City and County of Honolulu has 21 EMS units. That's 21 ambulances during the day. During the nighttime, that drops to 19. Now, if you have regular emergencies, people are still unfortunately going to have heart attacks, strokes, People are going to have childbirth at home. We need to be able to respond to those. So the other calls added onto that is going to overwhelm the system. So we're trying to make a preventative action right now and just let people know to use those other resources before it gets to that emergency state.
So we want to bring in some questions, and we encourage those viewers who are watching to definitely send in your questions. One of them may seem simple, but it's a good question to stress from Brandon. When is it appropriate to call 911?
Yeah, that's a great question, Brandon. Anytime you're having heart trouble, difficulty breathing, shortness of breath, anytime you feel altered, you don't know your name, you don't know where you are, anytime you're having profuse bleeding, you can't stop the bleeding, all definite times to call 911.
Okay.
And so
what about your resource?
Sorry.
Go ahead.
Yeah, you
go ahead,
talked
Ryan.
about some of those resources and those access to some of those resources. What about the PPEs? We know that we are seeing some of the shortages that are happening nationally. There's a big push right now for donations. Are you folks entering the field prepared with the protective gear that you need?
As of today, right now, yes, we're okay. But we do see potential of running out of PPE. So we are looking at ways to adapt with that. We are extremely grateful to everybody that's making those PPEs available. The N95 masks are desperately needed by everybody in the healthcare field. But that's another point to make, is that if we can eliminate some of these non-emergency calls, we won't waste those PPEs. Every time our crews are going out on a call, they must don those PPEs. They must put on the mask, the goggles, the gown, the gloves. And if then it wasn't necessary, we have to trash that stuff. So that's how the community can help us to conserve.
Absolutely. If someone has tested positive for COVID and they are having an emergency, or they're around someone that they know has this has the virus, what should they do when they call 911?
Tell us. Tell us it's a possibility that you have COVID-19, that you are exposed. Tell us if you already tested positive. We want to let our crews know these are people too at the end of the day. They're emergency professionals, they're medical professionals that are going to go in and they're going to help you and they're going to take care of you, putting their own risk at their own safety at risk. But the more information we can provide them, the safer they can protect themselves, so that when they go home to their families, they'll be safe.
It must be incredibly stressful for all those crews. Sorry, go ahead, Ryan.
Yeah, do you have sort of a percentage or a number of what is the volume like in terms of the amount of calls that you're getting that maybe are not COVID-19, but people think, I mean, just to give a better understanding of how much of this is taking up of your folks' time?
70 to 90 calls a day right now are COVID-19 related. Somebody thinks they have it. Somebody knows somebody that has it. Somebody's anxious that they might have it. And they might not be displaying any symptoms. So these are the type of calls that we're trying to mitigate. We're trying to ask people to use their discretion about. And also be patient. Again, the system is limited. We understand that there could be a delay, but we have to prioritize the emergency calls that are coming in.
Let's have you don your other hat, which of course is ocean safety. We're not seeing guards in the towers right now because the beaches are not supposed to be in use. But tell us, what's ocean safety's role when it comes to COVID-19?
Well, the lifeguards, they're still out there. They're still saving lives. Calls are still coming in for ocean emergencies. But that's right. If you go to a beach park where there's usually a lifeguard in the tower, there's not going to be one. They've been pulled back. They're going into what we call a mobile response, where they're in their trucks. Those trucks have a jet skis attached, and they're responding to emergencies that are coming now through the 911 system. If they're not at a particular beach at the right time in the right place, we do urge people, you have to call 911 if you're going to get an ocean safety emergency response.
How does that work for ocean safety? Do they have PPE? I mean, how do you give someone life-saving rescue in that kind of circumstance? I can't see someone going into the ocean with a mask. How does that work?
They've been told they need to. Yeah, it's not easy. It's a difficult scenario that we are having to deal with, but the lifeguards have been given PPEs, and that's why it's extremely important that people are staying home, because that's probably one of our riskiest situations. The lifeguards that have to go out into the ocean and keep themselves safe.
We do have a question. I think it's a pretty simple one, but are beaches off limits? We did hear from the mayor that officially the beaches are, but the ocean is not off limits.
Right, and that happens anytime we have a natural disaster. But this is, this is something different. You are going to jeopardize a lifeguard's safety if you go into the water and they need to rescue you, and that's probably as simple as I can put it.
Okay. We so appreciate you coming on. Before we let you go this morning, can you tell us sort of your final message to the community when it comes to EMS and ocean safety?
Well, thank you for having us on. And probably just the final message is, we know this is difficult. None of us like to be home, but we have to keep these healthcare providers safe and healthy, because we don't know how long this is going to last. We just saw our numbers are rising. They're rising quickly, and we expect them to continue to rise. And we need to get through this, and we will, but we have to try to still stay home, please.
Okay, thank you so much. Shayne Enright, Public Information Officer for EMS and Ocean Safety. Thank you for being with us this morning.
Thank you. Bye, you guys.
Well, the message there, obviously, stay home. And we heard there was a comment that I wanted to address. I'm looking through it now. Forgive the Kitschy says, why don't you set up a COVID-19 hotline, then triage from there? Well, it's really important to know, Kitschy, and we are going to put this in the description of the show once we're done broadcasting, that Queens does have a hotline number staffed with a nurse. It's 691-2619. And again, I'll put that in there. We mention it almost every show. You can call there. You can talk about your potential COVID symptoms, and that person can actually write you a prescription and you can get a test. So that is a way. And the other one that I love this, we see this back and forth here. There's a hotline here from HBG CCNL. I think that's somebody from the city and county of Honolulu, maybe, said there is a related COVID-related hotline from the city itself, 768-CITY, and you can also go to oneoahu.org. So those are two resources, the city itself and Queens, and of course, Aloha United Way 211 also has operators there who can help you with your COVID-related questions, as long as they are non-emergency.
Yeah, and I think we're going to see the need of some of those hotlines more and more as those case volumes continue to grow, as we do see more community spread. And again, we want the main message that Shayne kind of spoke about is trying to alleviate the pressure on some of these EMS teams that are going out. So anytime that you're able to call some of these numbers to try to see if you are symptomatic, get a testing, maybe in a private facility where you can get an assured answer if you have it and get a testing, that's the route to take. I think the priority for them will be anytime they're responding to a call for someone that has tested positive for COVID and that are having problems with shortness of breath and things like that. At least they can go to that person knowing that this is a potential threat because they have already tested positive. So the more that cases that we think we're able to test, the more that people are able to get those answers, the safer it will be overall for everyone else, especially those EMS officials that are going in there.
Yeah, and I thought she had a really good point about the PPE, that every time they respond to a call, they have to assume that that person could be a COVID risk. And so we don't want to waste those resources. I thought that was really important. We want to get to some of the other big headlines today. More evidence that indicates healthy people can spread the coronavirus. The paper has a great write-through about how dangerous it can be to contract this disease from people who are asymptomatic. So we really encourage you to go read that. Very interesting write-through. If you're hanging out with people and you think they're healthy, they may not be showing symptoms. They could still make you sick. That's why the social distancing is so crucial. And then Ryan, the Star-Advertiser's big question of the day.
That's right. The question really what do you think of the proposed release of lower risk inmates from overcrowding jails in light of coronavirus? We've heard the mayor and HPD Police Chief Susan Ballard really come out strongly against the releasing of any inmates. Of course, they are in tight quarters, and so the thought is that they aren't able to practice social distancing, that some of them are 3 to a cell, and in a way to help kind of alleviate the overcrowding that's happening in the prison system is to release some of those low-risk inmates from the prisons and potentially bring them back in later. So the Star-Advertiser, that's their big question of the day. Do you think that we should release some of these prisoners, or do you agree with the mayor and with Police Chief Susan Ballard that they should not be released? We want to hear what you think.
There's some judges that are making that call today. A lot of prosecutors have actually come out in favor of releasing these folks. So there is push-pull among the legal community, weighing the public health risks with the public safety risks. So please weigh in on that on the Star-Advertiser's main page, and let us know in the comments right now what you think of that. Where do you come down on this issue? We like to spread good news here too, and we want to show you our Hawaii hero of the day. This is the Show Aloha Challenge. Lanai Tabora, who many of you know, he's there. You can't see his face totally, but he's there in the front, and then that is Mike Gangloff of Mirror Image Construction. They're some of the folks behind this Show Aloha Challenge. This is a really cool idea. So they're raising money to buy meals for kupuna who are homebound or immunocompromised and probably shouldn't be heading out to restaurants or grocery stores. And they are delivering those meals to those folks. So you can figure out how to donate right there at showalohachallenge.com. Or if you are a kupuna or a caregiver and you want to find out if you can qualify for this, you call that number right there on your screen. They are taking all that information in, and they're doing this in participation with the St. Francis Healthcare System and Meals on Wheels and Elite Transportation. There's a bunch of folks who have come together. It's really amazing. They're hoping to deliver over 7,000 meals in a week, and they want to continue this program throughout. And they are also launching on Maui next week. So if you're watching from Maui, take a look at this, see if you could qualify. We know that so many people really can't risk going out right now. And this is a great way to support local restaurants in the process.
Yeah, this is a way to, of course, we know that this is a trying time, especially for restaurants that are now limited and unable to really service their clients and customers the way that they normally do. So being able to provide this conduit to help support kupuna as well as support restaurants is a great idea. So we encourage you to go check that out. Another thing that we also want to highlight here is a new website that is being launched or has been launched in a program to really help to trace the spread here locally. And so one way that you can help is a campaign that's actually being started, and it's hawaiifightscovid.org. And it's sort of like a survey that you would take to help track down the coronavirus here. It just will take a few minutes. It's very easy to do, and it helps to collect the data that is necessary to do this tracing in the community. And it kind of relies on where you've been. It asks questions about who you've been in contact with, if you've been outside of the state. Some of the questions that are asked to some of the people that are coming into the islands, what they want to do is they want to help to figure out where this is going, where it's spread, and really just try to help to prevent that. And so the more people participate in this challenge, in this survey, the more that they are able to get a better grasp on where it is and where the needs are. So the results of the survey really will help to identify the people that have been exposed to the virus and who are higher at risk. So we encourage you to go over there and take the survey. They also have, they're also on social media if you want more information on there as well, but hawaiifightscovid.org. We encourage you to check that out as well.
Yeah, not everyone can take a test, but everyone can fill this out, and this will help them trace. It's called community tracing. The concept is basically to see where everybody's been and who's been in contact with whom, and then try to find the hot spots. So it's a great program. UH researchers and some researchers around the mainland are behind it, and we really encourage you. I did it yesterday, took less than 5 minutes, super easy, and that way we can try to get this thing under control. We know a lot of you. Oh, let's get to Mary's comment. Says, do not release inmates. Panic and anxiety is already high and the crime rate will rise. Well, we're interested to hear if you think that that the inmates should be released or not. These are supposed to be low risk inmates, if you will. And I don't know if that's the correct terminology there, but yeah, low risk inmates. So these are, my understanding is that they're not folks who have been convicted of violent crimes, but still I think there is concern for the public safety risk. So we're interested, please leave your comments, let us know what you think, and we're hoping to have some law enforcement officials on this program in the weeks ahead. We are continuing this, so we'll be here with you Monday through Friday. Every morning to talk about what's on your mind. And we've got some really great guests lined up. Tomorrow we have Dr. Sarah Sarkis. She's a psychologist. She's going to be talking about mental health and how to deal with all the stress of all of this. You know, it's tremendous for anyone to take, whether you've lost a job or you're homeschooling kids or you're just stuck in a small space. There's so much anxiety. So we really want to talk to you folks about that. And we're so excited to have Sarah on. And then Ryan, a look ahead to next week.
Yeah, there's a lot of, we're trying to listen to some of the comments that are coming in. We know that there are still a lot of questions about unemployment. We already saw a few earlier today as well. Again, unfortunately, we aren't able to address every topic. This is such a wide issue, and it impacts so many different phases of our life. Of course, unemployment is impacting so many people right now. We had Scott Murakami on earlier this week, but because of that high volume, we're actually going to bring him back next week. So tune in next week, Tuesday. We're going to be speaking with him specifically about unemployment once again, giving you an update. I know that there are still people who are saying they're having a hard time applying online with unemployment and getting those benefits. We are also going to be seeing that CARES Act that really takes into effect the PPP plan that is going to be available starting on Friday. And so I know that there's a lot of concerns over, can you still apply for that as a business, even though you have employees that are under the unemployment system here? So we're going to try to get to all of those questions. We're going to collect the ones that have been coming in throughout the days, and so that we have Director Murakami ready to go. Again, that's on Tuesday, but on Monday, we also are going to be speaking with a doctor. Once again, Dr. Rupi will be joining us, a medical professional, to answer whatever questions you have. We want to specifically talk a little bit about masks and if they're safe to use. We're seeing a lot of talk here in the community. In fact, Lieutenant Governor Josh Green is also encouraging people to wear masks anytime you go out, regardless of if you have symptoms or not. So that has become a national sort of topic of discussion that we also want to engage in. So if you have questions for the doctor or for the unemployment, that's coming up early next week.
Yeah, we're really excited to have Dr. Rupi on to talk about that mask questions. I know in Los Angeles, the mayor there is now trying to require everyone to wear a mask, regardless if they're showing symptoms or not. And that again goes back to that article about people who are asymptomatic and are spreading the disease. So you may think that you're healthy, or you may think that guy in line behind you is healthy, but wearing a mask, a lot of public health officials are now saying that that could be a way to stop the spread. So we're definitely going to get into all of that with her. Type your questions. Let us know who you want to see on this program. Let us know who we should highlight as our Hawaii Hero of the Day. Again, that Show Aloha Challenge. We love that. We love helping the community, restaurants, and kupuna. What could be better than that?
That's right. And again, we want to just continue to encourage people to stay indoors. We do know that this could potentially be going on for at least a month, maybe even longer. And so I think a lot of people, one of the concerns that we're hearing now from state officials, as well as those dealing with this on the national level that have already been a month in this sort of lockdown phase, is that people are sort of getting complacent and they're getting tired of being indoors for 1 to 2 weeks, and they're getting a little more risky or lenient about going out and connecting with people. It's not easy. We recognize that, and I think officials recognize that as well, but they want to continue to really beat on that drum to stay in, because oftentimes it is going to get lonely for people, or it is going to get frustrating to be indoors for as long as we're expected to be. But they're continuing to really enforce that it is only going to get worse. And these are critical weeks, not only for the nation, but for us here in Hawaii as well, as we sort of try to implement this and keep those numbers from rising.
Yeah, and we hear you. We know that this is challenging, and that's why we have Dr. Sarah Sarkis coming on tomorrow. She's going to help us all with our mental health and help us to connect in new ways, like we are doing right here on the homepage of the Honolulu Star-Advertiser. The Star-Advertiser, of course, has great resources, all the cancellations, information about various programs. They've got a whole section devoted to COVID-19. So we encourage you to check that out. And again, we thank our partners with the Hawaii Executive Collaborative, that wonderful group of business and civic leaders that are working to make Hawaii a better place, are helping us bring this discussion to you. So until tomorrow, we say aloha.
We'll see you tomorrow.